having me tonight. On behalf of FLACRA, we have identified the following needs for funding and regulation waiver, and I'll just keep it short and sweet because many people have already said many of these ideas. The first is an increase in or additional funding for supportive living and housing opportunities within Schuyler and Yates counties. We are working towards supportive living beds. However, there's always a struggle to get the funding and the availability of appropriate housing and beds in our communities. An increase in and availability of Suboxone or buprenorphine therapy for opioid use disorder through the extension of the waiver to nurse practitioners and physician's assistants. MDs are currently the only ones who are available to get the waiver and prescribe Suboxone, and there are caps on the number of individuals who can be on their caseload. 30 individuals per doctor in the first year, 100 individuals at a time on their caseload in subsequent years. This means that they can prescribe as many opiates as are deemed necessary, but if somebody is struggling with dependence or a substance use disorder related to the opiates, the treatment, one of the treatment options for that, Suboxone therapy, is not available to them if there's not a doctor available. Vivitrol is an excellent alternative to this as well. However, there are some insurance issues with that, as well as some contraindications, especially for persons with active hepatitis, which often goes hand in hand with IV drug use. Increase in or additional funding for medically supervised outpatient detoxification programs with easement of regulations around this treatment type in order to ease implementation in our communities. There's little to no access to these services in our community, and when we look to get people into services, there is typically a significant wait time for those. And as people have said, if you want treatment, if you need treatment, it needs to be at the point when you're ready to accept it. You can't be waiting 6-8 days for detox. It just doesn't, it doesn't typically have positive outcomes. Increased funding for and early intervention services to allow for the identification and treatment of childhood disorders such as ADHD, things like functional language delays, and other issues that affect our, very young children. Research continues to demonstrate a connection between the childhood disorders and subsequent risks for the development of substance use disorders in adolescence and adulthood. And an increased support and funding for Narcan training kits and refills on the medication. Currently, there are some grants and easements available. However, we'd like to ensure continued reasonable and affordable access to Narcan for all who need it and their families. We appreciate the opportunity to share our needs and our concerns for the community, and we look forward to working together for the future in this and getting treatment to all those who need it in a timely manner. So thank you.
Thank you, Danielle. Next, Anne Marie.
Thank you. I am also a nurse practitioner, and I work in primary care. And I did talk with some of my patients that have substance abuse disorders and heroin issues, and there were a couple things that they wanted you to hear. The main thing is that they don't choose to be an addict. The addiction chooses them, and they don't want to be in the position that they are. They do support legislation that would allow drug dealers to be charged with homicide if they sell drugs to an individual who dies as a result of an overdose. So that's, I think, important for you all to hear. Healthcare providers are also frustrated with trying to treat patients with substance abuse disorders, and we are looking for more education at any point in time to be able to help us be able to care for these patients better and look for evidence-based practice treatment plans that would benefit them. But a few things, I'm cut this significantly shorter, but providing parity of access to services for all residents with mental health and substance abuse disorders in New York State, especially in the rural areas. As you all know, that there is a significant lack in the rural areas for people to be able to access services, especially for mental health disorders. And substance abuse is a mental health disorder, and we do need to destigmatize that out there. Increased transparency of services, decreasing barriers, and as Danielle did say, working with our DEA to allow nurse practitioners and physician's assistants to be able to prescribe Suboxone. This will allow a broader network of rural healthcare professionals to provide this important and effective treatment option in rural areas. And at this point in time, my patients are buying that off the street, which if they could get it from me, we would be much safer than buying something off the street that could potentially be laced with something else. Instituting a reporting system at the local and state level to capture statistical data for substance abuse to support systematic planning and treatment. Thank you.
Thank you.
Yeah, Anne Marie, actually, what you were referring to with going after the dealers, we have in the state Senate, I sponsor a bill, it's called Lurie's Law, that does exactly that. It goes after the drug dealers, mid and upper level drug dealers who are connected to the death, an overdose of heroin, and that the law enforcement agency can then go and charge that dealer with homicide. We got to get it through the Senate, through the Assembly, but we're working on it. And also you mentioned something, I think your last point that you mentioned was
The reporting system?
the reporting system. With the sale of over-the-counter of Narcan, naloxone, one of our fears that the task force has that we have a piece of legislation that we're actually trying to work it within the budget language, is to have DOH have a database, implement a database so that we are tracking how many kits are going over the counter, as well as every time it's being administered, it will be mandatory reporting. Keep in mind, we are not looking for the name and the address of individuals. We're very sensitive to that because we already know about the stigma. But we want to make sure, we want to gather the statistical information so that we can pinpoint exactly where resources need to be, where the problematic areas are throughout the state, and that will help get us down that road of more database statistical data so that we can use it.
Thank you.
So thank you.
You're on the right track there.
Thank you, Anne Marie. Mike?
Thank you, and thank you for having me tonight. The primary objective of the council is to provide education and prevention strategies to our counties, the communities, and the coalitions that we serve. I work in 5 different counties and about 15 different coalitions on many of the same issues here, so I see a lot of these in every one of the counties. One of the beliefs that we have is through the efforts of these efforts that we can reach families, youth, and the community members. And we can provide them with the capacity to make informed decisions about substance use and abuse. One of the programs that we have recently started to implement in Ontario County, actually, is a community-based or school-based education program. We have a contract with 8 of the school districts in the county, and we have educators that are in each one of those school districts full-time, or close to full-time anyway, to provide education directly in the school, so they integrate themselves into those programs. That's one of the programs that we would really like to see, some increased funding to be able to provide to not only Yates County, but a larger percentage of the county, or the schools within our catch basin, if you will. The program has seen some really increased needs. We've had a lot of requests from schools to, for more programming, for more of the forums that we've done, all kinds of different programming, not just for heroin, but all kinds of substance uses. So that's one of the programs that we really like to see, increased. Family education is also very important at the council. Not only reaching these kids at a young age, but also being able to provide families with the resources, the education that they need to be able to make informed decisions as family members, so that they understand the importance of, seeking help as a family. And the last piece that the council would like to talk about is the lack of opiate-specific treatments within our region. There are some options, but finding treatment that is dedicated to opiate use has been very difficult. Helping provide access to appropriate treatments is a vital part of the recovery process. So The Yates County community and the region as a whole has seen detrimental effects that substance abuse can have on their users, the families, their children, and the community as a whole. Reaching our youth at an early age and educating the family members is something that we see as a tremendously important piece to helping people protect themselves and make better and more informed decisions. So I'd like to thank the task force as well as everyone who came out tonight to help us push some of this forward. So thank you.
Thank you, and thank you to the panel for participating tonight. We'll get to our final panel here, but that's not going to be the end of the night. I know we're running on here, but we have our Yates County Public Health Department representatives here, and then when we finish with Deb and George, I'm going to give an opportunity for my colleagues to speak or ask questions of anybody from what we've heard. Since I don't let them speak at the beginning, so when it gets later, they tend to speak shorter, and they're politicians, so that helps in that regard. And then after that, we do want to open it up for questions from the audience. We have a microphone up here. We're going to ask anybody that wants to speak on whatever aspect of this whatsoever to come up to the microphone and state who you are and where you're from, and give a brief outline of the points you would like to make. And depending on how long that line gets will depend on how long I'll let you speak. But with that, we'll move on to our final panel here, and thank you for being here and your patience here to go last to kind of round this out with the Yates County Public Health Department Director Deb Miner and the Director of Community Services George Rotes. Deb, if you'd like to start out and give us your perspectives here on putting this all together for us here in Yates County.
Thank you. Thank you, Senator O'Meara and task force members and audience. And being the next to the last speaker, I will be very brief. And I'm going to just highlight, so I hope it doesn't sound too chopped up, and I hope it makes sense. First, I want to note that we do appreciate the governor and the state legislature's efforts in making heroin and opiate a top public safety, public health, and mental health priority in 2016. And we know that the governor has put mention of this in the executive budget. Across New York State, many of the law enforcement offices and public health departments have been working to implement the opiate overdose prevention programs, the Narcan kits and training. Since we started that program in the fall of 2014, we have trained over 200 law enforcement and community members, and we have distributed over 700 kits in Yates County. This is not a measure that's going to prevent our problem, but it helps to give that addicted individual and his or her family an additional opportunity to seek treatment and work towards recovery. So even though we now can access the naloxone at the pharmacies, I would ask that you not cut the funding to that program. I think it's crucial that we at Public Health and the other opiate prevention programs have the opportunity to train folks on how to properly use this. And it also gives us another opportunity to give them some information about recovery and treatment resources. We have heard from many of the folks on the panel tonight, and we've also heard from our forums about the barriers that the families and the individuals suffering from addictions have in dealing with the insurance companies. So again, we applaud the efforts of the legislation in what they are doing to no longer permit insurance companies to require a fail-first policy. We need to stick to that. We need to hold them to that. And so we do ask for your commitment that will take place. And we also are appreciative of the new real-time online tool for families and providers that they can access at the OASIS website in locating inpatient and residential treatment beds. However, anybody who looks at that will see that the capacity is not sufficient. I have seen mentioned that the executive budget proposes $7 million in new funding and proposes 300 new treatment beds to be developed over the next 2 years. This is good news for the state, but please make sure that some of these beds are coming to the Finger Lakes area. They cannot all go downstate and to the metropolitan areas. It needs to be fairly distributed. Again, I don't want to be too choppy here, but I'm trying to be brief.
Take your time.
At Public Health, we are also asking for continued movement towards the integration of outpatient drug treatment into the more traditional medically focused healthcare settings. We need to have comprehensive treatment plans for our patients which address the medically assisted treatment, behavioral counseling, identification and treatment of infectious disease. We know that the use of heroin and other injectable drugs brings risk for HIV and hepatitis C. We need screening for comorbid psychiatric diagnosis as well as care of their medical needs. So we do need to have this as an integrated approach and not be sending patients to multiple different locations to receive their treatment. Those in recovery have spoken to us of the increased social acceptability of using heroin by the youth and young adults and of the increased availability. Parents have asked us for assistance in understanding how they can best prevent their children from making choices that lead to addiction. We know that the issue of addiction cannot be effectively addressed through treatment alone or through the arrest of those who are selling or using illegal products. We must focus a portion of our resources on prevention. And I would bring your attention to programs that are evidence-based and proven strategies such as Healthy Families New York and the Nurse Family Partnership, Parents as Teachers, and the Parent-Child Home Program. I would ask that funding not be diverted from these programs. We need to have these programs to continue to help our families. But we also need to look for expansion of programs that move beyond the preschool years. We have to find ways to help our families to parent and to have those difficult conversations with their children and help to prevent some of these folks from turning to use of substances. There are some new tools online through OASIS, tools such as Talk to Parent and the Kitchen Table Toolkit. We need to locate additional resources such as these. And I think I've hit all of the highlights, and you do have my written testimony. Again, I thank you for this opportunity, and I look forward to continuing to work and to address this issue. Thank you.
Thank you very much, Deb. And George.
Well, I have the auspicious position here to be the last speaker from the panels. First of all, thank you for everyone for hanging in there. The support in this community is tremendous. I could repeat and say ditto about almost everything that's been said tonight. We've heard about the agony. I want to just counterbalance that with saying that the involvement of the community with the coalition and in efforts to really corral this epidemic is just tremendous. This is a great community that has come out and is stood up for change, and we certainly do need change. We have a whole world problem. From a public health point of view, it's a community problem which requires community solutions. One of the things I want to suggest that I haven't heard, I've heard allusions to it, and that is we need to be able to offer you and community members in general ways in which they can participate more fully, both in helping protect their children from the scourge of either mental illness or substance abuse, to help your children grow healthier and to be stronger and more resilient. The schools play a part in that, but every family and every community plays a big part in that. There are programs that are being sponsored across New York State, across the United States of America. There's two great programs that basically begin to do that. One is called Mental Health First Aid, which is really directed at adults to learn about substance abuse and mental illness and what you can do as a family member, as a partner, as a sibling, as an employer, to really help someone that you see maybe having a mental health problem. or a substance abuse problem. It's training that can be offered to schools, offered to the community, offered to child care organizations and other organizations that work with adults at all levels. Doesn't require a college degree, but it does give skills to people, and it orients people to their role in having a healthy community. The Youth Mental Health First Aid Program is specifically focused on youth. We know that when we ask people who in fact are addicted, 90% of them say they started while they were in school. Do you hear that? They started while they were in school. They're the target for us. You heard from the educators. You've heard from other people here. Early identification and early prevention is really a core. They can't all be in school. They're in school a few hours. They're home and in their neighborhoods the rest of their lives. So we all need to be part of the solution. We all need to be willing to step up and learn. We all need to be willing to step up and find new ways for us to be involved and to make a difference. And I have a lot of other things I could mention. We don't have enough treatment. We don't have the right staff. We need more prevention. We have to look at early prevention, early identification. We have to look at support for those who in fact are addicted, to protect them and to support them in treatment and give them the treatment they need, to help them change the environments, because they can't stay in the same environment as an addicted person. They need to be able to move beyond that. So that's where I'm going to stop, but I'm going to say that there is a role for this community, and we really have to be invested with working towards giving people the tools so that we can move this army of people who now want to see a change forward and really do something in this community. Thank you.
Thank you. Now I'll turn it over to the chair of our task force in the Senate, Senator Terrence Murphy.
First of all, Senator O'Mara, it's an honor and a privilege for the invitation to come up here. I come from Westchester County. It's just north of New York City. This afternoon, I got in the car early and met Senator Amador in Albany, and him and I had traveled up to Oneonta to do a 12 o'clock task force meeting in Oneonta and then out to here. So it's been a long day, but well worth it. I will tell you that. To the panel of experts up here, thank you. Thank you for all you do for your community. Thank you for all you do for New York State. You folks right down there, Ariana, Devon, to sit on this stage and give your story, you are so far ahead of it. You're doing a great, great job. You keep it up. You keep it up. You should be damn proud of yourself to be able to sit up on this stage and share with everybody. That takes courageous, and it takes guts. And Alexis, I don't even know where to start. My heart goes out to you. You are so strong to be able to share that story with all of us up here. It's just, I got the chills when you were saying. I leaned over to Senator Ortt and I said, this is unbelievable. And I've been around New York State and I've heard stories, and it's pretty deep. And to be able to be here and share, I thank you. And for everybody who's sitting in the audience, it's now 9 o'clock at night, and you know what? To still be here says something to you and how much you care about your community, and to listen to all the experts up here, because this is a team effort. None of us have all the answers right here. This is why we go around the state, and this is why we listen to everybody, to gather the information and to make educated decisions on what's the best for your community. We don't know it unless you tell us. Yes, we have the experts. What was it, Sheriff Spike over here? You know what? It's you're hiding behind closed doors. No more. The stigma's got to go. This has no boundaries. It has no ethnicity. It has no gender. It has no religion. It will shake down really, really, really good families. And this is what communities are all about. is to rally around and make sure we do the right thing, to care for our community and make sure we can do the right thing. I'll leave it off with, it has been an honor and a privilege to be able to be here tonight. Whatever we could do as a panel up here, and Senator O'Mara, as your state senator, we are behind him 1,000%, and you're doing a great job, and thank you for allowing me to be here tonight.